Today's our topic is chest tube. Chest tube is also called chest drain, thoracostomy, thoracic duct, or intercostal catheter. First of all, we will discuss what is the function of chest tube. Then we will discuss contraindications. Then complications. So what is the function of chest tube? It drains out air from the pleural space, which is called pneumothorax, or it drains out fluid, which is called hydrothorax, or pleural effusion, or blood, called hemothorax. It also used for drainage of pus, which is called empyema. So, the function of chest tube insertion or chest tube placement, thoracostomy or chest drain insertion or thoracic catheter, it helps to drain out our air, fluid, blood or pus. What are the contraindications of chest tube? These are diaphragmatic hernia, or adhesions present in lung, or coagulopathy. Also, you can call it bleeding disorder. These are three contraindications of chest tube, that is diaphragmatic hernia, adhesions present on lung, coagulopathy, bleeding disorder. But actually, if these contraindications or these things also present, but if there is a life-threatening condition in which chest tube insertion is very critical, then these contraindications may be overlooked, and for patient safety, chest tube insertion or placement is mandatory. Next is, what are the complications of chest tube? It can be infection at site of insertion of chest tube. It can be bleeding, hemorrhage when inserting chest tube. Another, during placement of chest tube insertion, it can cause injury to diaphragm, spleen, but most importantly, most common complication of chest tube is chest tube clogging. Chest tube clogging is most important and most common complication of chest tube. What is meant by clogging? It is meant by there is a blockage of chest tube due to any cause, or maybe there is a stoppage of normal activity, normal passage of chest tube, which leads to clogging of chest tube and complications. It can lead to there is a bleeding around the heart and lungs, and leads to hematoma formation, which again needs to be drained out, otherwise can lead to deleterious effects. Next, we are going to discuss device, chest tube device, in which we discuss what is chest tube and what is the sizes which are different available in market, or how the material of the device is. So most commonly in adult males, size of chest tube which is used is 28 to 32 FR. In adult females, is 28 FR. In childs, 18 FR, and in newborn infants, it is 12 to 14 FR. What is FR mean? It is French catheter scale. French catheter scale, 1 FR is equal to 1 by 3 millimeter. So it means 1 millimeter is equal to 3 FR. It is showing that millimeter is larger than greater scale than French catheter scale. For example, if we have a external diameter of chest tube catheter 9 FR, then is equal to 3 millimeter. Chest tube device or chest tube drain is made of silicone or PVC. Remember, there are two ends of chest tube catheter or thoracostomy catheter or chest drain. One end which is attached to chest drain system, and one end which is attached to patient. The end which is attached to patient have one end which is toward patient, and 6 side walls. The end which is toward the patient is one end which is toward patient, and there are present 6 side walls. Actually, these and six side walls, these are called effective drainage catheter. EDC, effective drainage catheter. Because here six side wall and one end which is toward the patient, here the fluid drain out of the pleural space and collect in the collection bottle and attach to chest drainage system. Next we will discuss two most importantly, one is the thoracostomy procedure. What is the exact location where chest tube is inserted into the chest cavity, pleural space, and another, what is the chest drainage systems which are in use, and what is the mechanism of chest drainage system.